From Kern Government Television, welcome to this week's Kern County Board of Supervisors meeting, originating from the County Administrative Center located at 1115 Truxtun Avenue, Bakersfield, California. Kern County's vision is to create and maintain a customer-centered county government designed to garner the confidence, support, and trust of the people we serve. Today's Kern County Board of Supervisors meeting will convene momentarily.
Okay, board to reconvene. Good morning, Madam Clerk. Would you please call the roll?
Supervisor Gleason.
You there, Mick?
We'll see if he unmutes his mic. Supervisor Scribner.
Here.
Supervisor Maggard.
Here.
Supervisor Couch.
David, are you there?
All right, we'll figure out how to get our two supervisors online. And Supervisor Perez, you're here?
I am. We have quorum.
Okay, we're going to have the broadcast engineer work with those people to make sure that they can tune into the meeting. We have Supervisor Gleason and Supervisor Couch attending remotely today.
Okay. Madam Clerk, thank you very much, and good morning, Kern County. Welcome to the Tuesday, December 8, 2020 meeting of the Board of Supervisors. We will begin today's meeting with the flag salute led by Supervisor Zach Scribner. Following the flag salute, please remain standing for a moment of prayer, silence, or meditation, whichever you prefer. At this time, we're going to turn our cameras to our animal hero extraordinaire, Nick Cullen, who has brought a larger canine this time than we're used to. I can't wait to see him or her on the video. Are we able to show our furry friend here? Oh, there we go. Nick, can you hear me?
Yes.
Okay, great. Who do you have here with you? And that is a very big dog.
It is. Good morning. I have with me this morning Fritz. Fritz is about a 5-month-old, 65-pound puppy, Pyrenees pup. We don't know too much about him. He just came to us just the day before yesterday. We're still hoping an owner comes for him, but we are seeking foster, and we want to get his picture out there so that if he is available for adoption, that he doesn't have to wait very long. But he's a very big dog, and still a puppy. But he's a beautiful boy.
What a precious little creature. Nick, thank you so much. 65-pound puppy.
Yes.
Okay, well, good luck. That's a lot of loving right there.
Thank you.
Thank you, Nick, for all you do.
Appreciate it.
And it's a good doggy, it looks like. Mike, you want it?
I think I can hear the dog saying, Margot. Margot. Something like that.
Drawn to Margot. Oh, yes, and of course, Margot's birthday was yesterday. Happy birthday. Mine was Sunday. We're both 1 year closer to our death. It's very, very exciting, as you know. So we won't celebrate too much today. How's that? We'll just we'll stop talking about it.
Thank you, Madam Chair.
Happy late birthday to you. The County of Kern has provided notice that as a result of the declared federal, state, and local emergencies due to the COVID-19 pandemic, and in light of the governor's order, this Board of Supervisors meeting is not physically open to the public. Testimony in general public can be given through email or telephone to the clerk of the board prior to today's meeting, and live comments through teleconference will be heard during the meeting. We will begin by considering the consent agenda. The items listed with a capital C, capital A are considered to be routine and non-controversial by staff. Consent items will be considered first and may be approved by one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on consent, they may do so prior to a vote being taken on consent. A member of the board may also remove an item, and it will be considered in its listed sequence with an opportunity for any member of the public to address the board concerning the item before action is taken. A member of the public may also comment, of course, on closed session items. So consent items begin on page 2. They include items 1 through 7. On page 3, items 10 through 16. On page 4, items 17 through 23. On page 5, items 24 through 32. On page 6, items 33 through 40. And finally, on page 7, items 41 through 47. Madam Clerk, what do we have by way of public comment on consent?
We have no public comment on any consent agenda items. I would like to make sure that we have Supervisors Couch and Gleason able to communicate with us. So let's start with Supervisor Gleason. Mr. Gleason, can you hear us? I see that his microphone is unmuted. Oh, now it's muted. Supervisor Couch, can you communicate with us? Can you hear us?
We would like you to join the 21st century, please. I guess it's their choice, Kathy.
Okay, hang on just a second.
Margot, do we need 4 votes for consent? Okay.
So my understanding is they're both responding, they're both able to hear us. At this point, we are not able to hear them. So, Madam Chair, do you want us to take a brief 5-minute break and see if we can get this worked out? What would your pleasure be?
Okay, County Council saying, I mean, I don't know if there's a way to take a vote from them without, in the current circumstance. I mean, I'd like to move on while we work on it, but I'm gonna ask the experts.
If you want to, Madam Chair, if you want to hold taking a vote on the consent matters, that would be fine, and you could move on to either public comment or board member
Got it.
presentations.
That just makes too much sense. Thank you very much. We're gonna hold off and come back to consent when we've worked out our technical details with our 2 supervisors. Okay, so we're gonna move then to public presentations, which is item number 8 on today's agenda. This portion of the meeting is reserved for persons to address the board on matters that are not on today's specific agenda, but are legally within the jurisdiction of the Kern County Board of Supervisors. So now is the time to entertain such ideas and direction from the public. So Kathy?
Madam Chair, we do not have any callers this morning that wish to address your board under public presentations. We did receive 1 voicemail from Anthony Espindola. We will play that voice message right now.
Thank you.
Hi, my name is Anthony Espindola, and I'm from Boron, California. I own a business here, and am the current president of the Boron Chamber of Commerce. I'm calling in regards to the small forgiveness loans that you guys were giving out in Kern County. I believe it was $30 million worth of small business grants. And we're not aware of anybody in Boron who got them. And I know that those of us that tried just kept running into issues with different issues, but issues with the banks. I'm curious to know which businesses did get them, which people were able to get them, because I don't know any businesses or small businesses that did. And I'm just interested in the list of people who did get them, and if they were really small businesses, or if they were corporations, or if they were businesses that didn't qualify, because being a small restaurant, we're in dire need of aid, and so far Kern County hasn't really been able to do nothing except for block my driveway, block the street with their construction during the whole period in which I did get a grant from the federal government. So right now we're just looking for help from Gavin Newsom and the state, because Kern County hasn't done anything for us. And I want to know why, and I want to know what's going on. That's our money that the federal government gave to you guys to disperse to us for help. So we're going to end up paying it back whether we even got it or not. So we should know who got those loans. And I want to know if there's a list somewhere publicly that we can see who got those loans, because I think that everybody should know. Anyway, thank you, and bye.
Madam Chair and members of the board, that is the only public comment we had this morning for public presentations.
Thank you.
Excuse me, Madam Clerk, I'm sorry. Madam Chair, could I ask Jim Zervis to come up and respond? My understanding is he spoke to Mr. Espandola on the telephone this morning to help to answer his questions. And I think chiefly he's concerned about who received the loans and if there's a public list. And I think we've had that online for months. So Mr. Zervis, if you could help to respond to that, thank you.
Yep, Supervisor Scrivener, through the chair, I'd be happy to. I spoke with Mr. Espandola this morning, and I did follow up with an email and provided him that list. That list has been public. It's been on our website, and I know the newspapers have published that list as well. So I did follow up and provide that to him. I also gave him some information regarding the governor's announcements for some grant opportunities for small business support. His business is suffering, he explained, and so there might be some other resources there. I had a pretty good conversation with him talking about the CARES Act and the funding and all of the things that the county is doing, both for small businesses and for just the residents in general with that funding. And you know, he seems satisfied with the conversation.
Well, I appreciate that, and obviously our small businesses predicament has been one of our chief concerns in regard to how we've allocated the CARES Act money. I think we've gone to great lengths to try and provide relief to small businesses that were not able to access funding under the original PPP program. And so were you able to determine whether or not, it seemed like in his voicemail he may have referenced that there was some federal aid that he received. I don't know if that complicated matters for receiving our aid, because I know we did try to prioritize businesses that had not received federal aid.
So he did receive federal PPP funding. That's he explained that to me. It's not clear as to whether he actually submitted an application for our program, or if at the time PPP recipients weren't being prioritized and he didn't. So I just don't know. And wasn't able to follow up on that. He was concerned because when he received the PPP funding, the window of time to spend that funding also coincided with a road improvement project of the county's that was in front of his business, and caused him some concerns with just the timing of how that played out.
Yeah, I know that Public Works as well as my office was in communication with him about that, and you know, we unfortunately the timing of when we receive funding for these federally funded projects may not always be convenient for everybody, but I know that's an important improvement for the community, and so I'm glad that we were able to deliver that. But we do apologize for any inconvenience that it might have caused. Yeah. I appreciate you reaching out to him. Thank you for everything you're doing, Mr. Zervis. Thank you, Madam Chair.
Thank you, Supervisor Scrivener. Thank you, Jim. Okay, it appears as though we have gotten access to our other supervisors. Can you hear me, gentlemen, either of you?
5 by 5 for Mick.
All right, Mick, nice to hear your voice. Supervisor Couch, are you there?
I can hear you.
Okay, great. So we're online, excellent. We do need to take a vote on consent. I did list them previously. We did entertain public input, and now we are prepared to move forward on a vote. I understand we have a recusal. Is it item 11?
Yes, I believe.
Yes, ma'am.
Yes,
Okay.
Supervisor Gleason, do you want to go ahead and disclose your conflict?
My conflict is that my wife works for a hospital.
Okay, thank you, Mick. Kathy, so we're going to then entertain a vote when my colleagues are ready on the consent agenda as read, recognizing that Supervisor Gleason is abstaining on item 11.
Correct.
Okay, gentlemen?
Motion.
Thank you, Mike.
Second.
Thank you. We have a motion and a second. A roll call vote, please.
Supervisor Gleason,
Yes.
Supervisor Scrivener,
Aye.
Supervisor Maggard, Supervisor Couch,
Yes.
Supervisor Perez.
Yes.
Motion is approved, all ayes.
Thank you very much. We're going to move on to straight to 9 board member announcements and reports. Okay. Under board member announcements or reports, I'm going to come to our colleagues after we hear reports from Bryn Kerrigan, and then we'll go to Supervisors Maggard and Scrivener. So Bryn, welcome. Thank you for your hard work on the front lines of our COVID response. We appreciate you. And it's good to see you're healthy. You
Good
look
morning.
good.
Good morning, Madam Chair, members of the board. Bryn Kerrigan, your Assistant Director of Kern County Public Health Services. If you'll bear with me, it's been a busy couple of weeks, so I have quite a bit to update your board on this morning. I'm going to start with the new cases. Today we're going to announce 1,055 new cases here in Kern County, bringing our total cases in Kern County to 46,397. We're announcing one additional death this morning, bringing our total deaths to 457. Over this past week, there are 42 new positive staff within 12 of our skilled nursing facility and an additional 33 new positive residents within 6 of our skilled nursing facilities, with 27 of those new positive residents coming from what we refer to as the green zone, or not having any known exposures or not being a new admittance. So that spread occurred within the skilled nursing facility. Additionally, our prisons are experiencing significant increases in cases. Our 5 state prisons saw an increase in 126 cases in inmates in a single day yesterday. Our state monitoring metrics, our unadjusted case rate this week that'll be announced by the state today is 37. Our adjusted case rate is 40.3, which is a significant increase from last week, which was 34.5, but that has a lot to do with the testing rate. And we'll get to that in a moment. Our testing positivity rate here in Kern is 15.3% this week. Our testing rate, while staying relatively stagnant, is impacted because the state has increased their median testing rate from 272 last week to 362 this week, and that will be the case for the following 4 weeks. What that means is then our case rate is adjusted artificially because the state's testing mean is well above what Kern's testing rate is. Our health equity metric this week is 19.7%. I want to give you an update on our efforts in the health equity metric. On September 30th, 2020, the state announced a health equity measure as a component of the Blueprint for a Safer Economy, which became effective October 6th. This metric requires counties to implement more intensive efforts to prevent and mitigate the spread of COVID-19 for areas that have been disproportionately impacted by the pandemic. These areas were identified by the state as the lowest quartile of the Healthy Places Index. What that means is the county's census tracts that have been ranked using the California Healthy Places Index based on socioeconomic conditions such as education, transportation, housing, access to health care, and others. We have implemented multiple strategies to address these areas. The first is using a reverse 911 system. We recorded a message about free testing availability, which is transmitted through a phone call, text message, or email, whichever method is selected by each resident. Ready Kern messages have been sent out in 24 of the 35 census tracts, including Arvin, Wasco, Delano, McFarland, Shafter, Lamont, Oildale, and Bakersfield, reaching 67,323 residents. We've sent out a mass mailing to 56,000 residences within the 35 census tracts with general COVID and testing information, as well as information related to the Housing for Harvest program. On November 17th, your board approved the purchase of 12,000 gift cards to be distributed to individuals who obtain a test at a testing site within one of the census tracts in the lowest quartile. These gift cards were deployed on November 30th. Over the span of last week, 5,208 gift cards have been distributed. The Public Health Services Department staffs a mobile testing site that deploys 6 days each week to various locations within lowest quartile census tracts. These sites are identified, scheduled, and marketed in coordination with the Latino Task Force to bring free testing to these areas. We've also deployed a canvassing effort. We've deployed 2 teams of 10 individuals for door-to-door outreach within the 35 census tracts, speaking with individuals at over 1,500 houses. A majority of the individuals that our canvassers speak with are appreciative of the information that we're providing them. Canvassers are also gaining a better understanding of potential barriers to obtaining testing, which we are addressing with our testing sites. We leave PPE, including masks and hand sanitizer, and brochures related to available isolation and quarantine assistance programs. Both canvassing teams are in Ridgecrest today. On Thursday, December 3rd, Governor Newsom announced a regional stay-at-home order. Rather than implementing this order statewide, this order groups counties into 5 regions within the state and uses intensive care unit capacity as a metric for implementation. Kern County was placed in the San Joaquin Valley region along with Calaveras, Fresno, Kings, Madera, Mariposa, Merced, San Benito, San Joaquin, Stanislaus, Tulare, and Tuolumne counties. This regional stay-at-home order went into effect December 5th at 12:59 p.m. and will be implemented within all counties in a region when the regional ICU capacity falls below 15%. Late Friday night, the state reported that the San Joaquin Valley region's ICU capacity was 14.1%, which subsequently fell to 8.6% on Saturday. While this seems like a substantial decrease in capacity, it's important to note that the state changed the calculation of the available ICU beds during this time period to exclude pediatric ICU beds. On Sunday, the San Joaquin region's ICU capacity was 6.6%, and yesterday it was 6.3%. Because the region's capacity, the regional stay-at-home order went into effect in Kern County at 11:59 p.m. on Sunday, December 6th. The regional stay-at-home order will remain in place for a minimum of 3 weeks and will not be lifted until it is projected that the ICU capacity within the region will be at least 15% for the following 4 weeks. When the regional stay-at-home order is lifted, each individual county within the region will return to their appropriate blueprint for a safer economy tier. Regional ICU capacity will be evaluated on a daily basis by the state and posted on their website at covid19.ca.gov. Also, the state informed us last night they will be sending out a wireless emergency alert to cell phone users in counties that are impacted by the regional stay-at-home order at noon today. Looking at our hospital numbers, we have 661 available hospital beds as of December 6th. We have 41 available ICU beds. Last week at this time, we had 160 hospitalized COVID-confirmed patients. This week, we have 206 hospitalized COVID-confirmed patients. Last week at this time, we had 37 ICU COVID-confirmed patients. Today, we have 47 ICU COVID-confirmed patients. We believe we were able to replicate the state's calculation using data reported from hospitals. For today, we're estimating that Kern County's ICU capacity is 12.44%, based on the standardization factor that the state applies for the percentage of COVID-occupied ICU beds. Without the standardization factor, Kern's ICU capacity is 19.2%. Today, the state will announce the San Joaquin Valley Regional ICU capacity at 5.6%. Kern's hospital capacity fluctuates every day. However, overall, the stats illustrate our capacity is decreasing. Kern has been preparing for these hospital surges since the beginning of the pandemic. We meet regularly with hospital CEOs. The county and each hospital have surge plans in place. Staffing is the limiting factor. Your board graciously devoted CARES Act funding to provide ICU nurse staffing to Kern hospitals. As of last week, 28 additional ICU nurses have been added to Kern's hospital system. Furthermore, the county has been maintaining the alternative care site, which we call the ACS, keeping it in warm status and ready to accept patients with a 48 to 72-hour notice. Last week, the department submitted a draft COVID-19 vaccination plan to the California Department of Public Health for input. Once we receive feedback from the state on our plan, we will obtain stakeholder input to finalize that plan. As the governor announced in his press conference yesterday, we do anticipate the first shipment of vaccines to arrive between December 12th and December 15th, assuming the FDA authorization of the Pfizer vaccine occurs this week. As the CDC has prioritized, the first allocation of vaccine, referred to as Phase 1A, will be used for high-risk healthcare workers. We do not anticipate that this round of vaccine will be enough to vaccinate all of our hospital healthcare workers. We've been working closely with our hospitals who will distribute this first round of vaccine and will likely continue vaccinating healthcare workers, even those not employed by the hospitals, as more doses are received. Distributed vaccines will be closely monitored. Enrollment in the CDC's vaccination program which is required for them to receive the vaccine, requires agencies to agree to daily reporting of the vaccine. Doses will be reported in the state registry daily. Further vaccine allocation to these sites will be contingent on these agencies fulfilling their daily reporting requirements. We will follow the CDC's prioritization schedule to distribute further shipments of vaccine. We will add additional providers as we work through the prioritization list to ensure that the vaccine is readily available for those prioritized groups. As the vaccine becomes more widely available, we will utilize traditional communication methods as well as our canvassing team providing door-to-door outreach, the Latino Task Force, local community leaders, large employers, and faith-based groups to educate the community on the vaccine. Additionally, we're developing a COVID vaccination webpage. Madam Chair, members of the board, this concludes my update.
Thank you for that extremely thorough and helpful presentation. I'm sure my colleagues have some questions of you, so I'm going to ask you if you would stay close. I'm going to turn the floor over to Supervisors Maggard and Scrivener, who are our ad hoc committee, for their update. So thank you for your hard work and thank you for the update. Supervisor Maggard?
Thank you, Madam Chair. Ms. Kerrigan, could we dialogue a bit about some of these numbers? Thank you for doing a fine job for us. The amount of total positive tests in Kern County of 46,397. You and I have discussed this, but I want to make some points for the public to understand clearly. We have adjusted that so that there are no repetitive positive tests per person. Is that correct?
Supervisor Maggard, through the chair, that is correct.
So that means that if there's 930,000 people in Kern County, which is a pretty accurate number, 46,397 represents 1 out of every 20 people in Kern County have tested positive for the disease. I found that very difficult to believe because as I look around me, 1 in 20 people I know aren't positive for it. So you guys looked into that, not just because I asked, but you looked into that as you should. And I'd like you to confirm that my understanding is correct. Is it not correct that the reason that that number is so high is not that, well, the reason is that some households, many households, are basically everyone in that household got sick. So what that represents is that people are not necessarily getting sick at work or as they're out in the community. People are getting sick at home. Is that correct?
Supervisor Maggard, through the chair, that's correct. 60% or more of our cases are household contacts from the original positive case.
And then because people are not isolating in their home from the sick person, because oftentimes they don't know they're sick, that's how everybody in the home gets infected by the sometimes asymptomatic, the person that doesn't have any symptoms, but is still carrying the disease.
Supervisor Maggard, through the chair, that's correct.
Thank you. So the point I'd like to make to people is that as you go about your lives and you're out doing what you do, and whether you're working or you're essential or not essential, or your kids are in school or whatever it is, or even if on the weekend or over a holiday you have been in contact with other people and have let your guard down, particularly in the casual setting, with your family, even extended family or friends, and you're not wearing a mask when you're in presence of these people, that's causing, it's very clear to us that that's causing those households to become infected, because a person will pick it up and they might not know they have the disease, but they are infecting the very ones that they love. So if you are someone who, I want to make sure that you confirm this to be accurate. Is it not the case that if you are someone who has been around folks where they weren't careful, nobody was wearing a mask, whether that was Thanksgiving or some other time, if adequate care wasn't taken to make sure that everybody was safe, it would be prudent of you to get a test, because if you are positive for the disease and asymptomatic, you could be infecting the very ones you love at home and no one would know it. Is that an accurate way to say that?
Supervisor Maggard, through the chair, yes.
Okay, thank you. I just want people to be thinking about that as they go about their lives. I have no problem with them going about their lives and doing what they need to do, but they should take precautions to protect the people they love, particularly the people that they live with. Everyone, of course, but nobody would want to hurt their family in any way, and we kind of let our hair down there. With regard to ICU capacity, could you please explain to us what's the rationale for why the state is making the amount of capacity smaller by some, is it an arbitrary adjustment? How is that being adjusted?
Supervisor Maggard through the chair. I wish I could provide you with the rationale behind that decision. It does seem like an arbitrary adjustment, and what they're doing is any county and region that has an ICU capacity, that has COVID positive patients in their ICU that exceed 30% of their capacity, there's an artificial adjustment to the available capacity for every 1% that it exceeds 30% downwards by 0.5%.
So they're kind of magnifying a projected capacity consumption, even though it hasn't occurred yet.
Supervisor Maggard through the chair, that's correct.
Okay, I don't understand why and why that would, that would further penalize us, but okay. With regard to the hospitals, then, as we are looking at what capacity is available, and this would go directly to that number that adjustment that you just suggested that they are making. It doesn't the amount of capacity that we have, doesn't that represent the capacity before the surge in capacity has occurred at each of the hospitals?
Supervisor Maggard through the chair, that's correct.
So when will we know what that capacity is and when it has been stood up? Because it would seem to me that once that surge is in place, that will change all these calculations of what our capacity is.
Supervisor Maggard through the chair, the hospitals are required to be able to extend their capacity an additional 40% from their normal licensed bed capacity. Staffing does play a part in that, and that's what we're actively working on to ensure that they have adequate staffing so that they can surge up to that 40%. So we're actively working with them. I don't think that we have to, I think we need to be looking for creative solutions now to implement in the near future, but for, the next week or so, I think that, as we work on this, that we're okay.
Okay. Well, it's probably premature to roll out what all of them are, but I know that there are 5 or 6 different strategies that are being explored right now about how to expand this capacity beyond just our hiring the traveling nurses to come here. By the way, that process appears to be working as demand is calling for it, right?
That is absolutely correct.
Well, as these other strategies become implemented, I'll look forward to having you tell us more about that as we go forward over the next few weeks. Madam Chair, I think that's it. Thank you very much, Ms. Kerrigan, for your information, and I'll defer any other information to my colleague, Supervisor Scrivener.
Thank you.
Madam Chair, if I may, thank you, Supervisor Maggard. Ms. Kerrigan, thank you so much for your report. I just wanted to get a little bit of clarity. The artificial adjustment that you talked about regarding the hospital capacity, I understand if there's over 30%, that's COVID patients in the ICU, then that's when the penalty starts kicking in. Is that the standardization factor that you referenced?
Yes.
When you were speaking earlier? Okay. Did you mention something about pediatric beds having some kind of an effect on that?
Supervisor Scrivener through the chair, that is correct. When the state first deployed the program, while they took out the NICU or the neonatal intensive care unit beds, they left in the pediatric intensive care unit beds in the calculation. They subsequently then removed those pediatric ICU beds from the calculation. Okay.
And so I was writing these numbers down as you were speaking, but I may have gotten it wrong. Our rate of current capacity, or our percentage of current capacity, I think you said was 19%, but when you kick in the penalty, this arbitrary penalty, once again, that the governor has thrust upon us, our capacity is down to 14 point something?
Supervisor Scrivener through the chair, the capacity is at 12.44%.
Okay, 12.44, sorry. Mm-hmm. Okay, and so was I right, we would be at 19 without the penalty?
That's correct.
Okay, very good, thank you. Once again, this is another arbitrary penalty that the governor's office has put on our county, just like the testing rate penalty, which was a voluntary action for people. It's just frustrating that we have all these with these penalties that it seems like the governor pulls out of the air. Yet it causes our businesses to remain closed. It causes these stay-at-home orders to remain in place, et cetera, et cetera. And I just, I don't see any clear connection between these penalties and our overall ability to respond to the pandemic. Would you agree with that?
Supervisor Scrivener through the chair, yes.
Thank you. Ms. Kerrigan, appreciate it. Thank you, Madam Chair.
Thank you so much to our ad hoc committee members. Bryn, I'm hearing that the testing results are now taking over a week to get back. That doesn't work, as you know, consistent with encouraging people to be home during a period of time that's reasonable. So what can you tell me about that?
So, Madam Chair, we are seeing the tests take a little bit longer to come back to us, but that we probably anticipated that as we're seeing many, many, many more people statewide getting tested. The labs are, seeing a significant influx of tests. So we would encourage individuals, if they do get tested, if they do suspect that they could potentially have COVID-19, that they should already implement that self-isolation until they do get their test results. And then we're also looking at different labs that we can possibly utilize that maybe aren't at max capacity so that we get those test results back quicker.
Okay. Thank you so much. Keep us posted on that, please. That's super important. And incentivize people to go and to even believe in the process at all. You got to buy into that structure. So I appreciate what you're doing. Thank you. And that's important. When our fairground site went from 2 weeks to 3 days with Zach's help, that was just a complete game changer, as you know. And those factors are so critical. But statewide and even around the country, the demand is profound. So I get it. That's really an important piece, as you know. Thank you.
Absolutely.
Thank you for everything you're doing. We are done, Kathy. Is that correct with this morning's agenda?
Unless Supervisors Gleason or Couch have questions for Bren?
Thank you for that. I'm sorry, Supervisors Mick and Dave. Do either of you have questions for Bren?
For Mick, no. I'm good.
Thank you, Supervisor Gleason, and thank you, Supervisor Couch. Okay, then we are going to adjourn to closed session to consider the following items 48 through 50, and under County Council, items 51 and 54. Zach, thank you for the motion to adjourn. We'll see you at 2. You were ready to go. It was